COVID just kind of makes it even more complex. It really does. And there's some great tips in trying to explain. And what you'll find is sometimes it's really not a great idea to explain. It could upset somebody. So we're going to get into it. And somebody I think is near and dear to our heart, and many of the people on this call, and really her team and Positive Approach, which Melanie Bunn is on this call, and she's part of that team, is dementia does not rob someone of their dignity. It's our reaction. And that is so true. We can control how we are interacting with our loved ones that have dementia. And really, your primary objective should be to show love and compassion. I highly recommend you explore Positive Approach, because we've learned so much, and Gina and I just went through our dementia training certification, and Melanie was our mentor on this call, and it was absolutely one of the coolest things that we went through. The training was just a wonderful experience, and Melanie was there, and we did that up in Washington, D.C. So before we get started, I'd like to introduce our starting lineup. And our starting lineup for today starts with my wife, Gina Murray. She is the director, co-founder of Aware Senior Care and Home Care, and she is the driving spirit behind what we've become in 5 years, with 130 caregivers, and just been a wonderful experience. Also with us today is great picture, Latoya Galbraith. You'll get to see her live too. That's a great thing about this webinar. Latoya, we met, had a great breakfast at the farmer's market, right? She is a dementia therapist and consultant. She has a lot of experience working with families, and you'll hear from Latoya today as we all chime in on how we're going to care for our dementia fictitious client, Emma. Also with us is Melanie Bunn, and Melanie is a dementia mentor, coach, consultant. Had to stop right there. I was running out of text room. She also, in the roots, was also a driver and still very much involved with the Dementia Alliance in North Carolina. A great nonprofit serving North Carolina, an umbrella supporting families, research, and dementia. You'll hear more about that later on from Melanie. But as I said, Melanie is also a member of TIPA's A Positive Approach to Care group, a wonderful group. And Vivian McLaurin. Vivian is a care manager. You may hear the term, you will hear the term in this presentation, aging life care professional. Synonymous with that is a geriatric care manager. Vivian is part of a great team at Preferred Living Solutions that you will find out is a person or people that can help you holistically manage the entire care required for a family. Great individuals, great profession that a lot of people just don't know. And so Vivian will talk about, from their perspective, how they can help Emma. And then me, CEO of Aware Senior Care. Hi, everybody. So with our agenda today, what we'd like to do, and I'm going to turn this over to Gina, is we wanted to do kind of a setup and start out with some things we learned with TIPA, and also preview the Jemez model. So the bottom line here is everybody is unique. And when you're working with someone with dementia, you really need to understand where they are in their journey so you can kind of form your plan. And guess what? On any moment, that plan can change. But Gina's going to preview that to kind of set the tone. And then we're going to meet Emma, our fictitious client. And Emma she's great. She's fine. Everybody else, I don't know why they're worried about me. I have no problems. So we're going to meet Emma, and then we're going to all talk about how we would approach caring for Emma from our specific areas. And then we're going to open up a Q&A for everybody to ask questions to this great group of people. So at this point, I'd like to turn it over to Gina.
Thank you. So we learned through TIPA the 4 truths about all dementias. The first one is that at least 2 parts of the brain are dying. Many people think about losing your memory when you think about dementia, but it's so much more than that. But the brain cells are dying, so their processing works differently. In dementia, it's always changing and unfortunately getting worse. So just when you think you've got a good routine and you know how to handle things, it's going to change. dementia is not curable or fixable. There is no time where you can say, I beat it. Nobody beats dementia. And unfortunately, it's terminal. But then again, as Teepa says, so is life. So with Teepa Snow's positive approach, she showed us the Jemez model. And I love this because it really focuses on what the person still has, what the person living with dementia still has. And the more the care partners can understand how that person processes information, you can have better communication. It taught us that care partners should work with the person and not do things for them or to them. If you do that, frustration, both on the care partner and the person living with dementia's part, decreases. And then you have fewer episodes of combative behavior. Combative behavior is really an automatic reaction to something that they're scared, they're frightened, and they're defending themselves. So here's a brief look at the Jemez model. I love it. Sapphire, True Blue. We're all naturally aging now that we're in our 60s. We're slower to process, but hopefully we're still working pretty well. Then the first level is Diamond. So it's clear and sharp. They really need routines. With folks living with dementia that are at this level, take them out of their routine, it can cause real problems. And people looking at them may not know that there's any decline. The Emerald, they're ready to go. They don't recognize there's any changes in their abilities, but others are now starting to see it. And they may miss maybe 1 out of every 4 words. They may be really clear, and then there'll be loss of reason. So the Ambers are kind of caught in the moment. They focus on sensation. If it feels good, they're going to keep doing it. If it doesn't feel good, they're not going to do it. And they respond to how people act, not necessarily their words. So they'll repeat motions, and that can really frustrate a caregiver. Very little safety awareness. The Ruby, it's hard to see in these folks what's still possible. They have big movements and very poor fine motor. A lot of those automatic reactions, the flight, fright, or flight. Music is really important. It's important to all of us, but they can still sing the words, the hymns that they've known forever. And then the pearl is really at the end. And the beauty is hidden inside that tough outer shell. So it's really important to see what's inside. So for our purpose here is education, that there might be resources out there that you didn't know about. And please know that getting help is a sign of strength. It's not a sign of getting old or being frail. Getting help can help avoid a crisis. And being a nurse, I'm going to tell you that best to start with a thorough medical exam. There's different medical conditions can cause changes in cognition, so don't assume that it's dementia.
Okay, we want to segue into talking about Emma. And like I said, there's nothing wrong with Emma. It's all us. So we're going to talk a little about Emma, and I'd like we're now going to kind of flow into the team. I think it's appropriate with Latoya being our dementia therapist, and think of Latoya as we're sending in the scouting party. Okay, we don't know what to expect. So I'm an ex-military guy. Of course, I was submarine, so we didn't have scouting parties on submarines. But we're sending Latoya in to report back to this team, so we're ready to go. So welcome, Latoya. You're up.
Awesome. So I'm sure that when Gina highlighted some of the stages of dementia as well as their characteristics, that you either had mom or dad or another loved one in mind. Again, because you're here trying to figure out what your next steps are or what resources are available to you. So while I want you to keep that image of mom or dad in mind, I also want to present to you this image here, which is the lovely Miss Emma. So Miss Emma is now a widow as her husband recently passed away, and she has, I'm certain with some reluctance, had to move in with her daughter who she now lives with. As with most of us, the daughter has now been forced to work from home due to COVID-19 and CDC recommendations to stay at home. Now that the daughter is home consistently, she's noticing things that didn't necessarily stick out to her before, and she sees mom struggling a bit in certain areas. Of course, Miss Emma's response to that is, I don't need any help. Although we've noticed that she's wearing the same clothing over and over again, and now she's forgetting to take her medication. There has been noticeable changes in her physical abilities, and as a result, she's had a few falls. And along with that, she's refusing to take showers, and the daughter has summoned occupational therapy to address some of these issues. The daughter is also worried about mom getting up and wandering during the night as she tends to sleep a lot during the day. And Miss Emma was a bit of a social butterfly before the pandemic, but now the daughter is afraid that this lack of socialization due to the stay at home orders will have more of an adverse effect on mom. However, the rest of the family says, oh, mom is fine, just relax. Now, what would make this statement ring true is if family said instead, oh, mom is fine, just relax. Let's build our team by utilizing the following resources. So one of those resources being dementia focused occupational therapy. So if you're not familiar with OT, you may think, oh, well, we're just going to find Miss Emma a job. So not exactly. Many of you may be familiar with rehab in its more traditional sense, where it's lumped as PTOT and speech therapy. But occupational therapy is truly a discipline that is holistic in nature. We have the ability to address physical, cognitive, and environmental needs, which really does make it a catch-all in the world of rehab. And I did emphasize dementia focus because that is our specialization, and I feel that that is important to note, as there are a lot of other OTs who have their designated specialty areas as well. So essentially, we're able to go in, determine where that person is utilizing the Jemez model and the staging process that Gina alluded to earlier. So going back to Miss Emma, the daughter can definitely see that mom needs assistance. And one of the most challenging areas that we as OTs often see is in the area of ADL compliance. So ADL is an abbreviation for activities of daily living. And these are your routine, basic self-care tasks like bathing, dressing, grooming, toileting, things that essentially should be completed every day. So it is a hot button topic for a lot of families. So we'll start with Miss Emma's dressing dilemma. So her putting on the same clothes every day. In this case, what we would do is try to encourage our caregivers to play more of an active role by simplifying some of the choices as it relates to some of her clothing items. If I'm Miss Emma and I open my closet door and there's a ton of clothing options in there, I'm probably going to close it and say, you know what I'm wearing today is just fine. Remember, those in this particular stage, they see themselves as very capable and independent. So we as occupational therapists, we have to try to investigate to figure out what the source of those behaviors are. So asking what's happening to those clothes. A lot of my patients at the end of the day, they'll take off their clothing items, lay it nice and neat next to their bed, go to sleep, wake up, voila, here are my clothes for today. And again, you can't tell them otherwise in the sense of, well, you've already worn those and you wore those the day before. This is their reality. And as far as they're concerned, they've been doing this for as long as they can remember. I've also made suggestions to families to buy clothing items that are similar. If mom can't part with that pink sweater, what is the harm in having one or two more that are identical to ensure that the one that she's actually wearing is clean and not soiled? And again, this is all very individualized, which is why I do enjoy being out in the field, because I can do the investigative work and make those recommendations and assist in implementing, again, just seeing what works to improve some of those outcomes. And it's also helpful to know that not all of the issues will be cognitive in nature, but there may be some physical deficits as well. We know that Miss Emma is now at an increased risk for fall, so there are certain environmental modifications that we can put into place. Where is she falling? Are there visual deficits? Are these falls occurring in the bathroom? Should we consider color contrasting non-skid bath mats? Are there grab bars in place? Is her shower non-compliance due to discomfort or fear of falling, which are the two most common culprits for a lot of the folks that I see with dementia? Is the bathroom too cold? Should we warm it up and get it nice and steamy for Miss Emma? Again, their ability to regulate their body temperature is a lot different from ours. Should we invest in a handheld shower head so that the water isn't shooting out at them, which is what they may oftentimes perceive? A lot of them are accustomed to the more traditional sponge bath. And sometimes it's more contingent on what's going on with the person and their environment. So, for instance, what may have happened the night before? Was there a night before? Or did Miss Emma not sleep at all and she stayed up all night and now she's tired the next morning and we're trying to force her to take a really uncomfortable shower? Again, that's why investigating is key, along with understanding their dementia, along with other external factors that may come into play. And then looking at functional independence. The key word in that is function. Emma's daughter may need a break and she wants to find something for both her mom and her to engage in while staying at home. And remember, staying at home doesn't have to equate to staying inside. So, can mom help with parts of gardening? Can she assist in folding laundry? Can she fill the bird feeder? Can she help set the table? These will likely have to be modified to a certain degree, just depending on where your loved one is staged. But at the core, the engagement is there. And that's where we as therapists come into play to sort of maximize that functional ability or overall independence. So, asking what's preventing them from engaging, what is it that they want to do? What are their immediate needs? One quick note that I want to make is just to make you guys aware of what we call excessive disability. And that's having someone, and that can be any of us, perform lower than our ability level. So, we have the capability, but we're not executing. So, this happens oftentimes when we as caregivers we overdo, we overhelp, we overextend, and take on way too much responsibility, and we don't allow or provide the opportunities for our loved ones to complete these tasks independently. And whether or not we realize it, we can actually do more disabling when we adopt this model of excessive disability, because we're not marrying their cognitive stage with their functional ability. So, of course, it's a lot easier and quicker for Mrs. Emma's daughter to do the laundry, help with gardening, fill the bird feeder. Again, just essentially doing everything herself, but we're also doing Miss Emma a great disservice by not allowing her to preserve some of those abilities that are still intact, and again, engage her in some of those functional tasks that she may find meaningful. Again, that's the beauty of OT, and just sort of helping you figure out that balance, because we are aware of what lies ahead. So now I wanted to talk a little about safety. This may be a good time for Emma's daughter to consider proofing her home. This is also where occupational therapy and our home assessments come in handy. What are some hazards in the home? We know the prognosis of dementia, and that there will come a time where mom is unsafe more often than not. I know when my grandmother was initially diagnosed with dementia, she was living alone, and members of our family would just kind of go in periodically to check in on her and make sure things were okay. And the moment that my family knew that they were sort of in over their heads was when my grandmother took the Tupperware, placed it on the stove top, and proceeded to crank up the dial. So we got lucky in that instance, as someone in my family was literally walking through the door when this happened, but we still sort of shudder at the thought of what could have been. So again, at any rate and any possible moment you get, just try your best to be proactive, especially as it relates to your environment. Asking, is your yard fenced in? If you have an outside pool, is the pool covered? Should we consider outlet covers for kitchen appliances? Should we install hidden circuit breakers, which we probably could have done in hindsight, for my grandmother to prevent her from going in the kitchen and trying to initiate a cooking task unsupervised? Should we consider video monitoring if you are working from home and you just need that added oversight? So, all scenarios and interventions to consider. And then for those of you who may have loved ones who are residing in senior communities and this pandemic has made them want to exit seek a little bit more, what can you propose to staff to assist in redirecting and engaging? And that just brings me to my next point of redefining purpose and participation. So, what can we do essentially to meaningfully engage our loved ones? This pandemic obviously has disrupted the routine for a lot of us, and especially with our seniors with dementia, it's caused a lot of confusion, disorientation, agitation. So it's important that we continue to engage them in the same capacity that they were before. Now, the manner in which we do so will obviously be a little different, but again, the continued engagement is key during this time. Even something as simple as playing music during downtime is just a lot better than having mom or dad sitting in their room alone. So finding meaningful ways to keep them connected. Last week, I spoke about FaceTiming with one of my patients, and we reached out to her daughter, who she hadn't seen in over 4 weeks, again, due to the pandemic, and just how her face lit up when her daughter popped on the screen and they were conversing, complimenting one another. The daughter was showing her pictures of her great grandchildren. And again, this just oriented her in a sense and just gave her back a little bit of normalcy. So again, just a reminder of how important it is to find a new way to connect that's suitable and stimulating for our seniors with dementia. And then lastly, caring for the caregiver. So Emma's daughter now has mom and the family at home, so she needs a break. One thing that I've recommended is to try to work a little bit on adding structure, designating areas in the home for mom, for your kids, for work, again, just to try to minimize that disorientation. And also seeing in what ways family can chip in, who can assist in meal prep, who can help out with some of those functional tasks that I mentioned earlier. Another major goal of ours as OTs is to help educate and alleviate caregiver burden as much as we possibly can. However, we also know that as therapists, our treatment time is limited and we're not able to come in for those 4, 8, and 24-hour shifts to address some of those around the clock needs. So we will have to start discharge planning at some point, but we have to also make sure that we lay the groundwork to ensure that some of those resources are provided on the back end. Interestingly enough, I just had a conversation with one of my other occupational therapists, and we were just talking about the importance of being able to pass on the baton and how reassuring it is for us, especially on discharge day, to know that the buck doesn't stop with us. We've worked so hard with our patients and families, and sometimes we are a little apprehensive about letting go because of what that could potentially mean for our seniors. So that's why I'm so glad that we have the resources that we do. Home care in particular, they are the ones that I do consult with more often to ensure that our seniors with dementia can ensure that their physical, cognitive, and environmental needs are being met, as well as have respite as well, yeah, as well as have respite for you as the caregiver. So without further ado, I'd like to send it over to Gina to talk a little bit more about the home care's role with Emma and specifically for you as the caregiver.
So as I'm listening to this, I think as the audience, just amazingly how comprehensive that assessment and how many moving parts, probably things you didn't think of. And one question to you, Latoya, in your experience in terms of therapy, who needs more therapy? The client or the caregiver and family?
It's all one moving part.
So recons come back saying, Houston, we have a little bit of a problem. My recommendation is home care. There's multiple issues, dysfunctional family, or they're not really on the same page, and maybe a geriatric care manager, aging light care professional would be great. And also there's resources, education necessary. So maybe the Dementia Alliance. So now we're going to talk to the rest of the team here, how recon's done. Now, where do we go from here?
And we appreciate Latoya letting us come join the team. Many times we work along with home health. They're coming home from the hospital, and home care and home health will work together. And while we do a complete assessment, we always love coming in when home health is there because they've really done a home safety assessment, put a lot of those safety measures in place, and identified things. She loves gardening. She loves to go out and feed the birds. And darn if every night she doesn't put those clothes next to her bed. So we take all that information and help, that creates our care plan for our caregivers. We do know we assess not only the client's ability to function, but we're looking at the family. What's the family able to do? How can they support this person? This daughter's now trying to work at home. Now mom's living with her, but now she's trying to actually do some work, realizing you've disrupted the mom's routine. Miss Emma's routine is out of whack, and perhaps the daughter can't get any work done. So we would look if they would like us to work with them for consistent caregivers, because they really need to know Emma, her home, and her family. So our caregivers, we find it very, very important that they are trained to understand dementia, learning those levels, and that if you've worked with one person with dementia, you've worked with one person with dementia, because everybody's different. So we make sure that we follow the work of the therapist. We work on those established routines. We know routines very important to seniors, whether or not they have dementia. We would talk with the family, to the daughter. Okay, mom's up wandering around at night, so you're not getting any sleep. And then she's sleeping during the day so you can get some work done. Do we want to try to get that reversed? So maybe initially we need to start with nights so the daughter can get some sleep. And the caregiver's doing some reassuring things, trying to get the client back, get Miss Emma back to bed so she can sleep. And then if she's sleeping well at night, maybe a caregiver during the day so the daughter can get the work done. And the caregiver can be the one to help Miss Emma with that purpose. You know, your daughter's really busy. How about if you and I start working on dinner? Or let's get that load of laundry in together. So things that they would work together to use all of Miss Emma's capabilities. So it's an ongoing reassessment of the client and the family needs. And especially during this time, in this unprecedented time, we're all trying to figure it out. So we reassure families, clients, services can be stopped at any time. Miss Emma gets back on a good routine, the daughter goes back to work, perhaps going to an adult daycare would work for them. So we're always looking at that. We're always looking at the whole thing. But you know, while the caregiver's there, she was concerned because the out-of-town brother called and says, I don't know why you're there. You don't even need to be there. My mother's fine. And they give us a call, and perhaps we talk to the daughter and say, you know, maybe the help of an aging life professional, a care manager, might really help your brother understand and be a support to you. And then we also always refer to the Dementia Alliance for the great resources they have. So I'd like to turn it over to Vivian, who's going to help this whole family.
Well, the feet on the street at home care reported to LaToya, and you both agreed that maybe the aging life care professional can help.
We need another team member.
You know somebody?
I do. I know some great people at Preferred Living Solutions.
Well, what do you know? We have Vivian. Well, Vivian, tell us a bit about how you could come into this team picture and help us.
Awesome. Well, thank you so much. So, aging life care professionals, or as we're more commonly known, a geriatric care manager, we are holistic health and human services professionals. And we come in to wrap our arms around Miss Emma and the daughter and the brother that's out of town and everyone else that cares about Miss Emma. So what we like to do is come in and have an opportunity to really get to know who Emma is. I mean, just looking at her picture, I have so many questions already. She looks like a lot of fun. So we like to describe that what we do is help the care partners and the client, and the senior is always our client. That said, we try to give as much support as possible to her family and her friends and help connect the dots. The one thing about dementia is every day is a new day, and what may have worked yesterday, you get up today and Emma's not going along with that game plan today. So we like to sit with the family, really get to know all of the aspects of Emma's life and who her support network is. And one of the big things that we offer to so many families that are spread apart and can't hop a plane and come into the home and help the daughter now is to be that local emergency contact. So heaven forbid if Miss Emma's daughter gets sick, what if she gets diagnosed with COVID and her doctor says, well, you've got to self-isolate. You've got to stay away from your mom so that, you don't give the virus to her. So we would be able to become that facilitator to step into the daughter's shoes so that we can help coordinate with home health, with LaToya and with Gina and Tim and their caregivers, and try to make sure that things run as smoothly as possible for Miss Emma. One of the things that I've done recently is help families that are out of state help coordinate their parents telehealth calls with their doctors, since we're trying not to take our vulnerable seniors into the doctor's appointments now. Telehealth is new to all of us. And it certainly, if you're 86 years old, you love your flip phone, you probably don't have a smartphone, and you certainly don't know how to work your way through visiting with your doctor on a telephone screen. And so that's the kind of thing that we're able to provide a lot of background information, ask questions on behalf of the family, and represent Miss Emma and what her life is like. We also come in and try to help build a circle of support for that care partner, because we want to be with the family throughout the journey. As the dementia progresses and things change for Miss Emma, we know that that care partner is so valuable and is so important, and is going to need, you know, a village, as it were. We offer, when life gets back to a little bit more normal and we can all leave our homes again, we offer to take or accompany Miss Emma to appointments, to ask questions and to share information once again. And then we really, really try to be there for that primary caregiver, to facilitate family meetings when everyone is so tense at one another they can barely stand to speak to each other. We can come in and facilitate and try to improve communication. We really promote self-care. We recommend that our primary caregivers seek out support groups and resources. And for sure, a resource that's always at the top of our list for our families and our clients that have a dementia diagnosis is to refer them to the Dementia Alliance of North Carolina, an amazing nonprofit that does so much to help the families. And I can say from a personal perspective that they certainly supported my aunt as my uncle progressed through his journey with Alzheimer's. And so with that, I'd like to turn it over to Melanie Bunn, who is certainly one of my heroes, and learn something new from her every day.
That's wonderful, Vivian. Thank you so much. And that was a great overview. You can see the tremendous support. I know when we get involved with families, and I can speak from a personal experience, because someone told me about a geriatric care manager, and I said, a what? And found this wonderful resource to help me when I was in Florida and my mom was in New York. Coordinate things was a breath of fresh air. And when we have clients and somebody like Vivian or Michael from Preferred Living Solutions involved, we go, whew, great. We have a wingman, and we can talk and work together. So at this point, I'd like to turn over to Melody to talk about the Dementia Alliance and the tremendous support that group provides families, and Emma.
Well, thank you. And don't we all need extra help at this point in our lives? Whether it's COVID related or whether it's just life related, we all need that group of people who look at things differently, who see things differently, who know different things than I might know as an individual. And so it's really delightful and an honor to be part of Miss Emma's team. So Dementia Alliance of North Carolina has a lot of incredible resources. There's a dementia navigation program where you get a one-on-one opportunity to speak with one of the most amazing individuals in the whole world, Dee Dee Harris. Sometimes it's somebody else, sometimes it's me, sometimes it's somebody else. But truly one of the most loving, gifted people who's ever existed on the planet. And she is also really smart and knows a lot. So when you've got somebody who's really smart and they're really nice, yay, how much better can life be? So there are people there to help you. What makes a real difference, besides being really, really smart and really, really nice, what makes a real difference is Dee Dee and I and Lisa and other members of the team have worked with hundreds or thousands of people. So we've seen hundreds or thousands of different paths. Whereas if you're working with a family member, you might have seen one or maybe three, and hopefully not. but we've seen lots of different people's perspectives. So we have more information to pull from. And so that idea that you're working with people who've seen an awful lot, they've never seen your person, they've never seen this exact specific, but we've seen enough similar that it doesn't confuse us quite as much as it may be confusing for Miss Emma's family. They're really confused. On the phone, talking with family from out of state, Miss Emma looks fantastic. People who kind of slip in and out, Miss Emma looks wonderful. Her daughter who lives there, Emma doesn't look quite so wonderful anymore. So we've been through that with families, we've been through that with individuals, and it makes a difference when you're looking at it from that perspective. Dementia Alliance offers videos and webinars, and way back in the olden days, we actually did educational programs, and hopefully still plan to get back to doing some of those. But I'm doing recordings, I'm doing videos, we're doing things like online support groups. And one of the really important things for reducing your risk of developing dementia, ta-da, is actually doing things different. So if you try something new, you may, I'm cutting off my timer because I'm going to ignore it. If you try something new, may actually be reducing your risk of developing your own dementia. So try an online support group. We offer information about resources. So we do referrals to some of the people who are here and others, and respite support, even in these times of COVID-19. And the very last program is something called Music and Memory, which is, I am thinking I'm going to see heads go like this when I talk about the impact of music on brains, the impact on music on your body, the impact of music on your heart and on your spirit. Music just makes that connection that overrides brain function or brain change and helps us connect with ourselves and with others in a way that's truly beautiful. So that's just a little bit of many, many things that Dementia Alliance offers. And thank you for the opportunity to be here.
Can I ask you a question about music and memory, Melanie?
Absolutely.
If I had, a loved one who I thought that would be beneficial, I mean, how expensive is that program?
Dementia Alliance has a program where they can make that cost free. I mean, it doesn't have a fee attached to it, I think. So reach out to Dementia Alliance and they can help set that up. There, we are a North Carolina organization, and so the resources stay in North Carolina. And so we have people who've reached out and provided support so we can offer programs like Music and Memory at home.
That's great.
A tremendous group, and it's an honor to be on the board of the Dementia Alliance, the nonprofit. So like Melanie said, it's free. You call them, it's free. They're there for you. It's a tremendous, and a key part of what Melanie said, you hear about Alzheimer's, the national organizations. Dementia Alliance is made in North Carolina, put a stamp on it. Everything they do is focused on the great state of North Carolina. So it's a great group. We can go on talking on for a long time. Timer's up, right, Melanie? So I'm going to be really brief, and we're going to go into a fun part of Q&A. But, when we went through our dementia training, and I will ask a question to Melanie about positive approach to care at the end, so you all know about them, but they frequently in the training, it's always like, did you have an aha moment? What was your aha moment? And I hope within the audience, there's several ahas. Wow, I didn't know there was these great resources available. And I understand it's a team sport, and I don't have to go this alone, and I'm not crazy.
Right.
So, your takeaway is make a plan and know that if you so choose, you can reach out to great people like Vivian and Preferred Living Solutions to kind of be that coach leader that can coordinate with home care, home health, Latoya and her dementia coaching and assessment, Dementia Alliance. So, do something, make a change, because if you don't, nothing changes if nothing changes, right? So that's the point. So at this point, I would like to open up a Q&A, and Micah Kilgore, who's our office administrator, he's like Walter Mitty of Aware Senior Care. He's also
Does everything.
a coffee guy, actually barista, and he's also on this call our moderator. So Micah, could you take over and fire away to the panel?
My first question is, what's your favorite type of coffee? We'll get to that one later. No, we actually had a great question that's geared toward to everyone. So the question is, what's the difference in Alzheimer's and dementia, since those are different things? And as a caregiver, would I utilize the same techniques with each of these populations?
I nominate
Melanie.
Melanie Brun to answer that question.
And that is a fantastic question, and it's really a critical one. The reality is that dementia is a big umbrella term. It is a category, and it means that people have two or more changes in their brain that they acquire as an adult that are progressive and terminal. That's what dementia means. Underneath that umbrella of dementia are lots of different types of specific dementia. So Alzheimer's disease is actually one type of dementia, just like apples are one type of fruit. So there's something in common with all of the pieces underneath the umbrella, but they each are unique and different. Now, because there's not really changes, the changes are related to where in your brain you're experiencing brain damage. And so the progression changes, the presentation of symptoms changes, but most of the techniques, approaches, and strategies work for people, whether they've got dementia or whether they have a specific type of dementia or whether they're just human beings. And that's what I really believe, is that if we focus on the person part, then the dementia part comes easy. For example, how many of y'all like to be wrong? Anybody like to be wrong? And when you're wrong, do you like somebody to point it out to you in public? Human beings like that. And we somehow forget when people get dementia, they don't like that either. And so when we treat people with dementia like they're human beings, when we treat people with Alzheimer's type of dementia like they're human beings, or vascular or Lewy body or frontal temporal lobe, or whatever type of dementia it is, life gets better for everybody. And so dementia is a big category. Alzheimer's is a specific type. And generally speaking, most of the strategies, interactions, and approaches that I teach work across the board for people living with dementia and for human beings as well.
That was wonderful, Melanie. Thank
That was
you.
great.
And if you visit the Dementia Alliance website, by the way, you'll see one of the graphics is that umbrella that Melanie describes, and describes Alzheimer's and the various. So that's one of the beauties and one of the values of Dementia Alliance. Great question. Thank you. Micah.
Another one. So this one's geared towards aware senior care, home care. So I'm nervous about having anyone come into my house right now, considering COVID is out there. So what precautions are your caregivers and the office, what are they taking?
Okay, thank you. Because that's a big concern for families and clients, because it is the most fragile population we're going to see, is the seniors. So 24 hours before our caregivers get a visit, they have a screening that they have to answer. Do they have a temperature? Do they have any symptoms, coughing, any respiratory symptoms? Does anybody in their family have that? Does anybody they've been in contact have that? We have instituted with our clients really severely limiting any visitors. We have signs on their doors. You know, we appreciate there's a precious person living inside. Can we call or make or visit in another way? The caregivers are wearing masks anytime they're within 6 feet of the client. And that can be hard. It can be unsettling. So making sure before they get too close, take the mask on. Hey, it's Gina. I'm glad to see you, but to protect you and me, we're going to stay safe. Wear the mask. Our hand washing has not stopped. It is when you arrive at the client, throughout the visit, before you leave. It's hand washing, hand washing, hand washing. So, but it's a concern, and we're addressing that each day.
Thank you for that question.
Yeah. There's another one that's in a similar vein. So, but going off of that, I think to Ms. Latoya, so if that's the way caregivers are interacting with, or the precautions they're taking, should I concern myself with wearing this protective equipment when I interact with my mom? Let's get you unmuted there. Hold on.
I'm sorry.
Sorry.
You're good.
Am I good?
You're good.
Okay. It definitely varies. I mean, obviously, as the caregiver caring for your loved one, you're going to want to take each and every possible precaution. And again, just making sure that we're as safe and as clean as possible. Obviously, there are going to be scenarios, for instance, if you are helping mom or dad with dressing or bathing, where you can't necessarily keep that 6 feet distance in terms of proximity. So as much as you can in terms of utilizing PPE, I would recommend the mask can sort of be hit or miss. We certainly have a lot of those who are hard of hearing in terms of our senior population. And then just the anxiety that some of those masks seem to invoke with some of the clients, it can make for a more difficult interaction. So I think if you just sort of keep some of those guidelines in the back of your head while you are caring for your loved one. And again, Melanie Bunn has a great video. If you were to go to the Dementia Alliance website and see how to actually kind of coach your loved one through hand washing. So if you're able to participate some of those precautionary and safety measures with your loved one, it'll be a better experience for you all. And then again, you're still kind of taking on some of those roles and adhering to the guidelines that have been enforced again during this pandemic.
Great.
Very good.
So true.
So then, if that's the case, Miss Vivian, we need to make sure that all of our loved ones are taking precautions as well. So how do I get my loved one to wash their hands like we are all supposed to? They're pretty content the way they are.
Tough question.
Well, we talked about the importance of music and how that can be so beneficial for people that are living with dementia as well as human beings in general. And as a fan of TIPA's, I've learned the value in singing while we're doing a task and how we can put some more fun into a routine task. And so I know we're all either singing happy birthday to ourselves twice while we're washing our hands or running through the ABCs, but we can get creative and make it a team sport so that you can demonstrate to Ms. Emma what you're doing and you're singing while you're washing, and then try to get her to step up as you step away from the sink and try to keep the fun going that way.
That's really great. I think there's a little TIPA training speaking there.
Yeah, absolutely.
And I love that idea of getting people comfortable. Music puts you in a happy spot. Even singing lullabies when we were children that are so row, row, row you boat or something, getting in a rhythm. These are all great techniques that we've learned through the positive approach to care training. So thank you for sharing that. Great question. That was a tough one. Micah, we got time for maybe two more?
Two more, okay. Well, another one's for Miss Latoya. So how do I help explain this social distancing thing to my loved one?
Very good question. I found that it's a little bit more about what we do versus what we say. Obviously, again, depending on where your loved one is on the spectrum of dementia, you will want to approach it differently. But I think if we just make our best efforts to try to provide for an environment where we don't have to necessarily provide an explanation as to why, we'll find that it's a little easier to digest. And I think it's just a matter of just, again, putting us in those contexts or those areas. I mean, even this past Easter, I mean, unfortunately, we had to spend it away from our churches because we know that if we were in that environment, we would be a little bit more inclined to hug and to shake hands with those that we hadn't seen in a while. So again, there are definitely the guidelines and recommendations in place for that very reason. So it's just a matter of us taking that additional step to ensure that we're also creating that same environment for our loved one, because if their great granddaughter runs through the door, yes, grandma's going to want to give them a hug. So again, just looking at other means to, again, keep your loved one connected and engaged through other avenues, obviously, which is what we're doing now. So just, again, keeping those ideas and those thoughts going until this blows over, which will hopefully be sooner rather than later.
Got it.
Thank you.
And I think so. So one more question. I think this last one goes to Miss Melanie then. So my loved one likes to get out and go do things, go see their family, but they have early dementia. So how do I explain to them the need to remain at home?
Oh yeah, that explain word keeps coming up and up and up and up and up, doesn't it? Because we as adults have the idea that we are logic based. And yes, logic is important. So this part of your brain right here, your logic, your reason, we are doing things differently. But part of dementia is this isn't really as powerful as it used to be. So all of this explaining begins to feel like arguing and changes the relationship and the emotions. So just a couple of minutes ago, I said, how many of y'all like when people tell you you're wrong? Nobody likes that. The other side of that is how many of y'all like it when people tell you you're right? Anybody like that? I know. Go ahead and put your hands up. So we like it when people agree with us. So instead of saying, no, you can't go, agree with, this is so frustrating. I am so sorry. It's so frustrating that you have to be at home. I don't want to be at home either. You are absolutely right. This is not the way it ought to be. We had plans and we wanted to do stuff. So you know what let's do? Let's write a letter. And so then we move from this 3-step process of identifying the feelings, getting some more information, and then moving from talking to doing. So getting the feeling, this is really frustrating. It's not fair. You are absolutely right. What is it that you miss the most? Is it being with the person, seeing them, or talking with them? Okay, it's seeing her. You would love to see. That is so, you know, I've got a special phone here. Let's call and let's tell her how wrong this is. So it's that process of not using this because this is something. Have you ever had anybody in your life who just emphasizes your weaknesses and emphasizes what you're not able to do? You don't like them, right? So instead, we start to use things that are working. And what is working is connection and hearts and emotions. And so when we meet that person where they are, we can connect with them. And that begins to make a real difference. So let go of the logic and explaining and embrace instead the agreeing and the emotions. And then let's find something else to do. Magic words. Would you help me? Would you help me?
Mm.
Those magic words will get you far along the line of moving from this to something else.
Yeah. That's awesome. Hey, before I let you go, Melanie, and this is really the last question for the forum. We mentioned positive approach to care several times. Vivian, myself, Gina have gone through the PAC training. Can you mention for the audience just a little bit about what is positive approach to care and help for families and professionals like us?
Sure. Well, Tipa's company is Positive Approach to Care, and she does a good bit of online training at this moment. She's very easy to find on YouTube. It's TEEPA. Her company is starting to do some really reasonably priced programs. For example, 2-hour care partner skills training programs for $25, which is really amazing. The online certifications for professionals are available, and we're developing those and running those very successfully. And then things like there's a subscription program that they have in place where for a very, very small amount, you get access to a number of videos and resources that aren't available on YouTube.
Well, that's great. And just to kind of wrap, thank you, Melanie, just to wrap this up, I hope everybody on the call is inspired as I am just to listen to all involved in this call. Just incredible. You can see the energy and just imagine that I will stop. You just imagine that there's a great team out there And really all we wanted to do today was to hopefully ease your pain a little bit and struggles, that there is help. There are great resources. And just like Melanie said, would you like some help? There are great people to do it. And all of us come at it different ways. Everybody's unique, but know there's a team out there. And hopefully today you've learned about some great resources that you can research, call. We all talk to each other. So it's like everybody's emphasized this is a team sport. So I want to thank you, Vivian and Melanie, Latoya, Micah, Gina, everybody that was involved with this call. We absolutely love to do this with you all. Want to thank those that participated, and please feel free to reach out to any one of us for help, and we'll get through this time together. Thank you very much. And
Thank you, Kyle, in the background.
that's right, the producer. All right, till we meet next time. Everybody have a great day.